Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello, thanks for joining us for today's webinar. We're delighted to be partnering with the Accreditation Commission for Healthcare to share best practices for supporting caregivers during challenging times. My name is Laura Barnett, and I'm the Senior Director of Product Marketing for Axxess. Before we get started, let me tell you a little bit about ACHC and Axxess. ACHCU is the educational division of the Accreditation Commission for Healthcare, a national accrediting organization known for providing value, integrity, and the industry's best customer service. With a comprehensive suite of resources designed to help healthcare providers excel in their fields and prepare for accreditation, ACHCU offers program-specific materials, including workshops, workbooks, and webinars. Axxess is a leading home healthcare technology provider offering a complete suite of easy-to-use, innovative software solutions, empowering home health, home care, and hospice providers to grow their business while making lives better. Today, you're going to hear from Lisa Meadows and Andrew Awoniyi. Lisa has more than 25 years of experience in the healthcare industry, from acute care hospitalization, home health, hospice, and palliative care. Lisa is currently the Clinical Compliance Educator for Accreditation Commission for Healthcare, where she provides comprehensive clinical, accreditation, and industry education to ACHC customers and stakeholders, and assists providers with interpreting the ACHC standards and the Medicare conditions of participation. Dr. Andrew Awoniyi is the Director of Patient Engagement at Axxess. He's worked across the continuum of care with interdisciplinary teams to improve clinical, financial, and operational outcomes utilizing process improvement and information technology. He leads our patient engagement team at Axxess, working with professionals across the U.S. on improving their engagement with patients through the CAP surveys and other tools and processes. Before we begin, a couple of housekeeping items to make you aware of. Axxess will be providing one continuing education credit for this webinar. All registered attendees who would like to receive those credits must be present for at least 45 minutes of today's webinar and complete the post-webinar training evaluation. Certificates will be emailed to the individual emails registered for the webinar. Your phones have all been muted, although you may submit a question through our chat function. We'll follow up with you after the webinar to respond to those questions. Slides from today's presentation, along with a recording of the webinar, will be available after today's webinar and will be sent to everyone who registered via email. They will also be posted on both the Axxess and ACHCU websites. Lisa and Andrew, over to you.
Thank you so much, Laura, for that warm welcome. And we just want to welcome everyone again. And Lisa and I are truly excited to be here with you today to speak about the need to care for caregivers during COVID-19 and beyond. And this is a topic that's near and dear to our hearts as caregivers ourselves and healthcare providers. Just a reminder regarding the requirements for receiving continuing education credits or contact hours, completing a minimum of the 45 minutes of the entire learning activity, and then the post-webinar evaluation survey. We also wanted to just provide a shout out, belated shout out to our nurses. We know that this webinar happened to be after Nurses Week, but just wanted to acknowledge all the nurses that are on the call.
All right, thank you, Andrew. So today's objectives are we're going to review the key challenges that face healthcare providers and organizations, identify key signs of caregiver burnout, also discuss short-term caregiver management strategies, as well as the importance of building personal and organizational care plans for long-term success.
As we planned this webinar, we realized that now that we're in a virtual environment and we don't have the benefit of standing in front of all of you, we wanted to get a sense for who we're speaking with in order to better understand our audience and clearly to present the material in a manner that would be most beneficial. So on your screens, you should see a poll pop up, and we do have a few of these throughout the presentation, and we look forward to your participation. And we'll close the polling in about 5 seconds. All right, and we wanted to share that with everyone. So it looks like we do have a nice spread between clinicians and administrators or managers. And we do have a few VPs or directors. Thank you very much. And this was the audience we anticipated having. And we're glad that you've decided to join us. So just continuing on, we thought it's important just to speak to one of the challenges in healthcare, which is how do we, with the triple aim, we speak of how do we ensure that we deliver the best care experience to the greatest number of people in an equitable manner and in a manner that's cost effective. And that's the triple aim. I think most of us are familiar with that. And the triple aim is from the Institute for Health Improvement and the work that they did in consolidating a lot of the research around how to improve the healthcare system. Part of what we wanted to share and make a case for, which is probably already intuitively known, is that there's potentially a fourth dimension or fourth aspect, which is the healthcare team. We've all heard of healthcare providers being called heroes for all the work that they're doing and all the work that they will continue to do around COVID-19. And so in preparing this presentation, we wanted to ensure that we got a chance to really speak to the importance for the care team and healthcare providers, and the fact that we cannot successfully reach our goals with the triple aim without this fourth dimension of the care team. And that's part of why we wanted to use that as a foundation for our discussion. In order to continue to deliver the best experience during COVID-19 and everything else that we're dealing with, we also need to ensure that we're thinking about our care team and our healthcare providers. There's been quite a bit of research around the close association between patient satisfaction and healthcare providers, along with costs and obviously the need to be able to reach the greatest number of people with that care. And so throughout this presentation, we'll just be touching on some of the challenges that care providers have been dealing with and ensuring that whether you're a care provider or you happen to be managing them, we'll leave you with a number of tools that you can use.
So burnout among caregivers, you know, this is nothing startling, I'm sure, for anyone, but prior to COVID-19, healthcare providers, who we're calling in this presentation the caregivers, have experienced, you know, challenges prior to, but have also reported higher stress levels and complaints than any other employees of any other industry. So a survey conducted in 2014 by Career Builder showed that 69% reported feeling stressed and 11% highly stressed, and 25% reported looking for other work within the next year. So that's pretty discouraging. Professions that involve human contact and rapid decision-making skills, while those decisions can have a serious impact, whether that be financial, social, or other, are among the most stressful ones. Well, that's exactly what healthcare providers do on a day-to-day basis. So, you know, prior to COVID, our industry was already reporting that they were very stressed. And of course, with the addition of the pandemic that we're experiencing now, things typically don't get better during situations like this. So what we're going to be talking about today, again, is ways to help identify and manage the stress that we're experiencing, the additional stress.
So just to add on to that, another study, and there are numerous studies, we just selected a few that we felt would help lay the groundwork and provide some context, is this research that was conducted almost 10 years ago out of the Center for Health Outcomes and Policy Research, which is housed in the University of Pennsylvania School of Nursing. They essentially looked at data for close to 100,000 nurses, and they used a number of surveys that went across a number of different states. As they looked at that data, they used the Maslach Burnout Inventory, which we'll talk briefly about a little bit later, which is an industry standard for really looking at burnout amongst various professions, including healthcare. And they essentially looked at job dissatisfaction, which is a precursor to burnout and burnout itself. They classified nurses that reported either being somewhat or a little dissatisfied or very dissatisfied on a four-point Likert scale. And any nurse that indicated that as an option fell under the job dissatisfaction category. And as we can see, they split the data across the acute care setting, more of a hospital setting, the nursing home, and other settings. So in our case, we would fall under the other settings. Pharmaceutical organizations also fell into this category. As we can see that in red are nurses that are providing direct patient care. The blue are nurses that aren't providing patient care. And then the green are non-nursing roles. Overall, we can see that, at least from a job dissatisfaction perspective, in the home health, hospice, or we can just use the term in-home care arena, we tend to be, should we say, more satisfied or less dissatisfied with our jobs, but it's still over 10% in most cases, even though when we look at burnout, we're also lower in general, but much higher rates when it comes to nurses providing direct patient care and non-patient care in terms of their level of burnout. So we know that burnout and job dissatisfaction is very real, just looking at some of these numbers.
So what are some of the possible warning signs or common symptoms of burnout? And I can tell you, when I was researching this, the symptoms vary greatly from the source, from one source to another, but the common ones and the ones that I felt were the most significant are these right here: irritability, frequently calling out sick, intolerance to change, exhaustion, and checked out mentally or compassion fatigue. Now, I know a lot of you may be chuckling to yourself, as I did when I read some of these. We often feel these symptoms, and I would not describe myself as being burnout in my profession or even when I was in direct patient care. But what you need to examine among yourself and as well as your colleagues and your coworkers, are you seeing this behavior as pervasive? Is it more often than not? It's not a single event that happens that just kind of rubs you the wrong way. It's this pervasive feeling, this pervasive response that is not the norm. It's not how you typically respond. And, of course, if you're starting to have some of these symptoms already, a pandemic's not going to make them better, as we've said. We've seen some very positive examples of positive behavior on social media and the news, which I think, helps to remind us of why we're in the business, and helps relieve some of that stress. But there are some people who are really struggling to hold it together. You know, I don't know if you've seen this or read this on, you know, any of the posts, but I like the reference that we're not all in the same boat. We may be in the same storm, but we're not in the same boat. And some people may very well be experiencing this pandemic vastly different than someone else in their personal life. You know, from unemployment to family being sick to the fear of themselves getting sick. So this is something that needs to be taken into consideration, as well as each individual's circumstance. But the symptom here that struck the most for me was the checked out mentality, or the compassion fatigue. And the reason is, you know, compassion is at the core of healthcare. It's why, you know, I think if you polled everybody who is in healthcare, the vast majority would say that they went into healthcare to care for people, to help people going through a difficult time, to make that situation better. And when we start feeling this compassion fatigue, which is defined as the physical and mental exhaustion and emotional withdrawal experienced by those who care for sick or traumatized period over a people of time, you know, that just goes to the core of what we do as healthcare. But I do think this is, I kind of wish this was number one in the list, because I think it is the most important. When you are noticing yourself or your staff are just feeling they're just not emotionally connected anymore to their job, that might be, you know, a possible sign of something more significant.
Thank you, Lisa, because I think we can all relate, like you said, to those brief moments of maybe feeling irritated at something. But it sounds like if we find that our colleagues or family members are saying, you just seem so short these days, that might be a warning sign. So we also have a poll that we were interested in asking, really just to get a sense for whether you have seen any signs in yourself or others around you or in your staff that make you believe that maybe some of them may be on the verge of burnout. And as you've noticed, this is an anonymous poll, in case you were wondering. And we'll close the poll in about 4 seconds. And share the results. And we really do appreciate you being open and sharing some of the challenges that you're seeing or that you might be expressing yourself. So it's clear that exhaustion is at the top of the list. And we know this list could be a lot more comprehensive, but we wanted to select the key ones. We can understand the idea of compassion fatigue, like Lisa mentioned, that checked out mentality, but we know that we still need to be there. And then obviously the irritability is a very natural response when we feel overwhelmed. So thank you again for just sharing with all of us some of the challenges that you're facing, or that some of the things that you've seen as well. So we figured that maybe some of you might not have assessed your staff, and if you haven't, we wanted to share some tools that might be of benefit. Obviously, there's a long list of tools that can be used to assess dissatisfaction or burnout or compassion fatigue. We just selected about 4 tools that we wanted to share with you, some in the public domain and others that may require purchase. And we'd love to hear back from you if there's is an instrument that you've used with your staff or that you've participated in that you feel was extremely valuable. So we had mentioned earlier the Maslach Burnout Inventory. Dr. Christina Maslach happens to be a psychologist who almost 40 years ago had done quite a bit of work really looking at occupational work burnout, written numerous books and articles. A real popular one is The Truth About Burnout, a great read for understanding how to engage staff, and also developed this Maslach Burnout Inventory. It's a number of questions that focus on a number of key areas. And they've developed a number of different tools off of the core questions. The one of particular interest for us in healthcare is really the MBI Human Services Survey for Medical Personnel, or the abbreviated acronym is MBI HSS. And we've included a link for those who might be interested in pursuing it. But essentially, there are three main scales that they look at, which is emotional exhaustion, which measures feeling of being emotionally overextended and exhausted by one's work. And as we could see from our polling here, that is clearly an area of concern. Depersonalization, which measures really that sense of on-feeling or impersonal response towards patients. Lisa had mentioned compassion fatigue, and depersonalization definitely plays into that. And then it also measures personal accomplishment, that feeling of competence and successful achievement in one's work, which we know can be extremely challenging when we're putting forth a lot of effort and we're not really seeing the results that we want to see. A complementary tool is this Pandemic Experiences and Perception Survey, the PEPS. It was developed by a colleague of Maslach, which is Dr. Michael Leader. He created, he actually worked with Maslach and has collaborated with her, really looking at assessing the engagement of employees and really looking at the workplace, designing the ideal workplace. And this particular tool, as you can see, looks at everything from the disruption and resources all the way to perceptions of leadership and even an open-ended area for any additional comments. And this particular tool you can find on their website, and this is also free for those who might still be looking to really assess your workforce and your staff, and really looking at what their perceptions are of the pandemic. The American Medical Association, very concerned about physician and physician burnout. And so what they've done is they've shared these tools free to any organization that registers. The first one is really the Coping with COVID-19 for Caregivers survey. As you can see, it's 12 questions and really designed to look at the impact of COVID-19 on clinical staff. The Pulse survey, just 2 questions, which are intended to be administered roughly every week for those who want to, and they provide a way to administer the test online as well. So that's another instrument that can be used for really looking at burnout. And the PHQ-9, I'm sure most of us are familiar with it because we probably use it to assess depression in our patients. This could be a great conversation starter. There are tons of online versions, free, that can be used to administer it. And it could be even used as a way of asking everyone to take the depression screen, the PHQ-9, and simply have a discussion. They don't have to share their results, but just have a discussion around that. So it would be a great conversation starter as a way just to assess where staff are at. And maybe just putting together a Survey Monkey, or you can even do it if you don't have the full resources in Google Forms, and just asking people to anonymously record their answers, just to give you a sense for where your staff are at. So we were wondering, we shared these tools, but we were just curious in terms of what assessments have been used by all of you who happen to be on our call, in terms of what have been the results of using any assessment that you've used within your organization, and what those results have been. And we understand if no screening has been conducted, hopefully with some of the options that we've given you, you'll be able to conduct those. And we definitely recommend doing them online if all your staff have email, and then assuring them that it is anonymous. Great. We'll go ahead and close the poll now. And in sharing the poll, it looks like the majority of us haven't conducted any screening. For those who have, we would, if it were an open forum, we'd love to open it up and just hear what your experience has been like. But if you want to, you can share those in the comments. Thank you very much for taking the poll. We're going to move next to, so now that we understand what our challenges were, and obviously we knew that even before coming in, but even during this presentation, how do we begin to address caregiver burnout?
So most of us, as we're aware, stress, depression, you know, these feelings that we have, a lot of times it's as a result of when we feel we don't have control, or we are losing control, or have little control over what's going on in our environment. And so it is this locus of control that as we feel we're losing, as we, you know, in a situation like a pandemic, there are areas where we don't have control over certain situations. That is when you start to suffer from the stress, the anxiety, and depression. So what we want to be able to look at is helping ourselves, helping our coworkers, our colleagues, understand where they do have a sense of control in an environment, and when we feel things are very much out of control. Go to the next slide. So cognitive behavioral therapy, and I'm just going to go over a few, you know, theoretical approaches to this. And it's not to make anybody an expert in delivering cognitive behavioral therapy, or to say that anyone needs to go to therapy. But cognitive behavioral therapy is the umbrella of how our thoughts turn into our actions or our behaviors. You know, CBT, as it's called, is that very idea of what we think turns into how we feel and how we act. You know, that negative and unrealistic thoughts can cause us distress and result in problems. So when healthcare providers interpret loss of control, it's that internal communication that we have with ourselves that then tends to result in feelings of stress, depression, anxiety, or resulting in negative behaviors. So the next couple slides that I'm going to go over are just to give you an awareness of what that internal communication is. So rational emotive behavior therapy, REBT, is a type of cognitive behavioral therapy, which is basically the umbrella. And the goal of it is to change irrational beliefs to more rational beliefs. So then it goes back to that locus of control. What are we telling ourselves when we're feeling this loss of control? And then what is that internal communication we have in our head, those common irrational assumptions? And a lot of these are things that I think a lot of people can probably identify in themselves on a routine basis. The idea that one person, that you should be thoroughly competent at everything you do, especially based on your position within your organization. And seeing that we have managers and administrative staff as well as frontline staff, often as a manager, you feel I've got to have the answer for everything. The idea that it is catastrophic when things are not the way you want them to be. That the end is near, the worst possible situation is going to happen when things are not exactly as I want them to be. And the idea that people have no control over their own happiness, or in this case, over their own situation, over their own emotions. The next model is called the ABC model, and it is activating event, belief, and consequences. And it's kind of the same theory. It's that negative emotional and behavioral consequence, rather than a person interpreting these events unrealistically, then has the consequence. So, the pandemic and then your irrational belief causes the stress or the anxiety or the depression. And what the ABC model does is it teaches people to think about, again, that belief system or that irrational thought, or just be aware of the internal communication that you're having with yourself during these events. So on the next slide, we're just going to kind of break this down. So the negative event to a rational belief to a healthy emotion versus a negative event, same negative event, irrational belief, an unhealthy negative emotion. So, in the COVID situation, a person could have their irrational belief that they can't stop the spread of this infection. We've read a lot of stories. People are having a lot of anxiety around this. People who are frontline workers not wanting to go home to their family, being very fearful of going home to the family, in that they're going to infect their family or they're going to infect the next patient. And so this irrational belief that I can't stop this is totally out of my control, leads to an unhealthy negative emotion of stress, anxiety, depression. Well, if you flip that to a rational belief system, what is rational in this situation? Maybe you cannot stop it, but you can help spread COVID-19. We as healthcare providers know proper infection control, using our PPE, hand washing, very simple things that we know as healthcare providers can help stop the spread. So replacing that irrational belief with a rational belief then helps for you to have a more healthy emotion than an unhealthy emotion. And as we know, the repeated activation on a stress response takes a toll on the body. I mean, we know this as healthcare providers, that chronic stress contributes to high blood pressure, promotes the formation of artery clogging deposits, and causes brain changes that may contribute to anxiety, depression, and addiction. So, we know that this constant response, or this constant exposure to stress, what it does to our body, very negative. And so the parasympathetic and sympathetic nervous system, again, this is not new for those of you listening to this. As we know, the body's fight or flight response is controlled by the sympathetic nervous system. This is the fight or flight response. This is what elevates and activates everything in our body to prepare for the situation that we are facing. When the parasympathetic nervous system is activated, it produces a calm and relaxed feeling in the mind and body. So this is the sympathetic, is known as the fight or flight response, and the parasympathetic, I hadn't heard this before, but is referred to as the rest and digest response. So one of the things that is making our lives different. Many things are making our lives different during this experience, but healthcare providers, we already have an increased exposure to that fight or flight experience. So we're already at a high level based on the nature of what we do. One of the interesting things that I read was an article from a physician who noticed that his parasympathetic system response was routinely activated during patient contact. When he was in this fight or flight situation, when he would engage with patients, his parasympathetic nervous system would be activated. So therefore, by having that contact with patients, his response would lower. His heart rate would lower, his blood pressure would lower. But the problem with COVID is this increased use of PPE. And, when you sit next to a patient, we start to mirror that patient. We as the healthcare provider want to calm that patient down. So we start to lower our voice. We start to slow our speech down. We reach out and touch a patient, hold their hand, touch their arm. We relax the muscles in our face. All of this to convey to them that things are okay, we're going to take care of it, all of those nice touchy-feely things that we do as healthcare providers. Well, he noticed that because of the use of PPE, this was not naturally occurring in his body. And so his sympathetic nervous system was, on high alert all the time. He had to then take time out to activate his parasympathetic nervous response. So that's what we need to do now as healthcare providers, is remove ourselves from some of these fight or flight experiences to be able to calm ourselves down. So learning to trigger your parasympathetic nervous system, as we know, is a great way to reduce your sense of anxiety and stress. It also lifts your mood. Now, granted, sometimes you're not able to do that in the moment. But one of the things that you can always do is just breathe. It's kind of like the t-shirt that says stay calm and carry on. That is what you want to do. You want to remember to slow your breath down, inhale fully, hold for 1 or 2 seconds, and exhale for 1 minute. That will automatically start to activate your parasympathetic nervous system, slow your response down. Sometimes you need to change your focus, if possible, walk outside, or, between patient visits, from home visit to home visit, oftentimes we're rushed, we're getting in the car, we're going to the next visit, the phone is ringing, we got, verbal orders coming in on the phone. Sometimes you need to shift your focus and say, I'm just going to concentrate getting from point A to point B. I'm not going to be distracted by everything else that's going on. I did hear a colleague say to me that lives in California that the nice thing about this pandemic and home care was that traffic was better in certain parts of California. So, that, she said, was relieving some of her stress. In this time, listen to music that invokes positivity. Music is a great way to activate your parasympathetic nervous system. Focus on a calming word. It's like meditation. Focus on something that helps, again, activate your parasympathetic nervous system. Visualization, repetitive prayer, and of course, a healthy lifestyle that involves exercise. We all know that exercise helps to, again, decrease our stress and anxiety, which hopefully in turn leads to decreased burnout, and of course, meditation. So these are all things that we can do to control and activate more frequently our parasympathetic nervous system.
Thank you, Lisa, and I appreciate the example you gave of the person who's driving, because I think the point you made earlier about cognitive behavioral therapy and the fact that our thoughts turn into our feelings. And it just reminds me of, the advice that we're given, which is to really look for the silver lining in every situation. And I think it's a nice entree into really thinking about the stress continuum model. I think we all understand this innately, knowing that if we start out on the left side, which is green, we're functioning optimally, everything is going well, and then on the far right-hand side in red is when things have gone horribly wrong, and we're on the point of some sort of mental disorder, and we're suffering from PTSD, depression, anxiety, and in some cases, unfortunately, substance abuse. And so the idea is we move between that ready state and being optimal and really being where we literally do have a clinical disorder and we really do need assistance. Hopefully, the majority of us are somewhere in between where we find ourselves reacting, or we may be dealing with injuries, and really understanding and working to gain perspective as to where we're at on that continuum, and realizing that we might not stay in the same place, and we might be moving even throughout the day in between reacting and being ready, or reacting and being injured. But the goal is obviously to move back to being in a ready state. And a model that we wanted to share with you actually comes out of the Veterans Administration and the work that has been done on PTSD. And so the stress first aid actually is adapted from the stress and combat operational stress first aid model that is used with Marine Corps and Navy personnel. And let's just go through it real quick. If you notice, the arrows start with a major stressor. And what we need to do is keep checking and coordinating, that is, seeking to identify ways to relieve that stress. Those are things that we'll continue to do constantly. And then we'd move to the cover before eventually moving all the way to confidence. And what we mean by those are, the idea of checking is really just being self-aware. And hopefully that's one of the things that we'll walk away with is, we may have been peripherally aware, but becoming more aware of how our body is responding to everything that's going on around us, really assessing ourselves. We typically do a good job of assessing our patients, but it's really assessing ourselves. And then if we realize that we're in a state where we really do need additional assistance, it might be a trusted friend or peer, or it might be to reach out for help within our organizations, or in the case of administrators and directors of nursing, it's helping our staff in terms of really accessing the resources that they need. And so again, if we're thinking of stress first aid or first aid for stress, these are some of those interventions, and those are things that we want to constantly do. And then depending on where we're at on that continuum, really being able to use these 5 interventions and strategies, where with cover, we're essentially looking to remove ourselves or remove someone in our environment from either whatever is causing that stressor, so taking cover, and if it's a continuous stress, if possible. And then really working on the calm piece, which is what Lisa was talking about with seeking to engage our parasympathetic, seeking to de-escalate, as it were. And then the connect piece is looking for that support and really beginning to work around problem solving with our employees. We know that PPE was a major stressor. It may be within your organization. Fortunately, there are a lot of resources that have been put out, but really looking to connect ourselves or our colleagues to the source of help that's needed. And then competence is really, again, the reminder as healthcare providers, we already know it, but at times we just need to be reminded and really working on walking through how we can get back to that, to eustress or being healthy. With confidence, obviously, as we continue to gain knowledge around our feelings, we're connected, then we can reach a point where we can learn to deal with our major stressors. I think in the early days with COVID-19 and all the uncertainty drove a lot of stress. And I think as we've had time to digest all the data that's coming out from across the world within the United States, I think for me, what I've realized is it really boils down to standard precautions, assuming that everyone's infected until proven otherwise, and then taking precautions to minimize transmission where there's a confirmed diagnosis or there's a suspect. So it just reminds us again that we know how to deal with these things, but because of all the uncertainty, it causes us to be under continuous stress. And so selecting some of these strategies as a way of continuing to work through that. So at an organizational level, and really thinking about dissatisfaction and burnout and everything that we've sort of talked about, obviously, we all talk about leadership, and I think we recognize leadership when it's there, and when it's not there, we miss its absence. And so our goal is to continue to be leaders, even if we don't have a formal title, and really working on checking in with our colleagues, whether they report to us or we report to them, and ensuring that we're asking them those questions around how they're doing. The use of incentives, obviously incentives can be perverse at times, and so aligning incentives in a way that ensures that our staff aren't being burned out. Obviously, there's a need to offer overtime, but especially if there's a lack of resources. But as we know, staffing being the challenge that it is, there are a number of solutions out there. And so if we know that we have an employee that's, working overtime week after week after week, and we know we need them, or we have several employees, we need to check in with ourselves and see whether we might not need to use a solution that allows for the use of outside staff, but who can deliver care the same way our employees would. And obviously with work-life balance, that goes without saying, that can be a challenge at times, but continuing to encourage that and model that. And obviously peer support or a buddy system where we encourage our employees, or we can create a formal program where there is a buddy system where I might not be aware of the fact that my shoulders are constantly hunched up because I'm stressed, but maybe someone that I'm in contact with or that I'm very comfortable with would notice that and might point that out as a sign, along with some of those things that Lisa mentioned around irritability and really being stressed. And then self-care and mental health. Obviously, not all organizations are in the position to offer those benefits, but if they are available, ensuring that we're communicating that to our employees and ensuring that they're availing themselves of those opportunities.
And to further that, You need to make sure workloads are manageable. And this is for both the administrator manager as well as for the clinician on the front line. It's a manager's responsibility to ensure workloads are manageable. But as a frontline worker, you too have to have a responsibility to speak up if things are becoming unmanageable. Encourage and practice self-care. Model that behavior on, again, both sides, administration as well as frontline staff. Be okay with saying no. That is difficult to do in a healthcare industry, and I know it can have big impact on an organization. But right now CMS is expecting agencies to not take COVID positive patients if you don't have the PPE to be able to provide care for them. So you really do want to make sure you're in a position to be able to care for a patient and keep your staff safe before you accept a patient that is positive for COVID-19. Delegate appropriately at work and at home. This kind of goes back to some of that, those irrational assumptions that everything has to be the way that I want it to be. I have to be competent at everything. You don't. And sometimes you need to delegate and you need to be okay with how things are done when you do delegate. It may not be the way that you want it done, but as long as it's done appropriately, safely, then it's okay. Diversify. And what I mean by this is broaden your horizons to the point that you are not becoming so focused on everything as it relates to COVID-19. There was the same phenomenon after 9/11. People became anxious and depressed because they were inundated with all of this information after 9/11. Well, we're experiencing a lot of the same thing with COVID-19. It's on the news all the time. It's like this running cycle of how many cases and how many deaths, and it's on social media. You need to learn to diversify, excuse me. Expand your horizons. One of the best pieces of advice I got when I started in hospice was don't have lunch with another hospice colleague routinely. And that's what we do. We tend to eat lunch with the people that we work with. But then what happens is you tend to discuss that's the same situation going over, that's going on and on. You need to sometimes remove yourself from that situation in order to be able to manage your own mental health. And the use of humor. As we know, humor can be very effective in the physical release of tension, but I would encourage you to proceed with caution. Humor can be very effective, or it can also be very damaging, or it can be totally misinterpreted. As I said earlier, we may be all in the same storm, but we're not in the same boat. And I saw a posting on Facebook. Somebody had posted a picture of some Clorox wipes and I think some hand sanitizer and posted it on a table. And this was a decorating group on Facebook, and the person had written, should I put the hand sanitizer to the left or to the right? Well, most people laughed, but one woman responded that this was not funny, that this was a very serious situation, and people, did not have the supplies that they needed, and unfortunately, a lot of people were very critical of her. And I thought, what people don't realize, or what people are not taking the moment to appreciate, this woman must be experiencing something for her that's very scary. Maybe she has family in healthcare. Maybe she's in healthcare. Maybe she's elderly or has comorbidities that make her at greater risk. And this is a very scary time for her. So we need to be very careful with humor and realize that not everybody is at the same place that you are. So you may not want to be humorous to other people, but you may want to seek out experiences that make you laugh, that you find funny. And I will just say personally, since all this has started, I've become addicted to TikTok, which I really don't know what that says about my personality at this stage of my life. But one thing it has done is it has distracted me, and it has made me laugh at some very silly silly things that are going on out there. And I'll turn this back over to Andrew now.
No, I think adopting TikTok is okay, given all the time that we have at home these days. So this is just an extension to what Lisa stated, and for those of you that have the slide and have looked it over, the idea is how do we make ourselves anti-fragile? How do we become even more proactive? Because we know that there's still a lot of uncertainty. There are people in our lives that may be out of work or may not know when they're returning to work. Or some of us on the in-home care side may be furloughed or working less hours. So because of that, we need to keep moving forward. And I wanted to share real quickly, since we're starting to wind down, just 3 names, and I encourage you to go online and just Google Virginia Harris, 103 years old, survivor of COVID-19. Marilee Shapiro, 107 years old, COVID-19 survivor. Genevieve Kuntz, 103 years old. We know that there are a lot of other names of people who didn't survive COVID-19, but just ensuring that we believe that the future will be better. We must continue to forge ahead. There are those who would say that at 100, all the cards were stacked against you. But these and many other seniors have survived the virus. Others have not. However, we can choose to focus on believing that the future will be better. And then reminding ourselves of our purpose. As Lisa stated at the beginning, we know that we were called into this profession to care, to support, and that's what makes us tick. So reminding ourselves of our purpose and our why. If we need to rest for a while, that's okay. Even athletes that have trained for years sit down on the bench and rest, but they get back into the game. And then just ensuring that our focus is on those small successes. Lisa mentioned humor. If we had time, we might even have done a small exercise around how to laugh from the belly so that you fully enjoy the benefit of that deep, invigorating laugh, but not at the expense of others, obviously, but even if it's in private, we know that there are benefits to laughter. And then just persistence. We do not intend to lie down and curl up in a ball. We will continue to forge ahead. And just remembering that and looking and surrounding ourselves with people who help continue to reinforce those stories or looking for those kinds of stories online.
And just a quick review.
Go ahead.
Yes. So just a quick review of some of the key things that we've talked about. We know that the satisfaction of healthcare providers directly relates to patient outcomes and patient experience of care. There's a direct correlation there between the mental health of your employees to the outcomes that our patients do get to experience. Healthcare providers have dealt with dissatisfaction and burnout prior to COVID. This is not new, but as we've said, then having a pandemic does not make the situation better. Organization and self-care combined is required to successfully combat burnout and fatigue. It's got to come from both avenues. It's got to come from, the top down and the bottom up. And COVID-19 is a defining care delivery opportunity for our generation. This is something that, Andrew discussed in the last presentation that we did. And Andrew, I know you probably want to add to this as well.
Yeah, I think we've all come across the statement, let no good crisis go to waste. It's something our CEO likes to say, just to help focus the team on going, yes, we can focus on the problems, or we can look at what we can do within our power, and how we can use it as an opportunity. Adversity is what shapes us. We all learn when we're not comfortable. If we look at it, we've always learned the most when we were uncomfortable. And COVID-19 has definitely made us uncomfortable. So what are the opportunities? We'll do that. We'll cover that in another presentation, but just continuing to stay focused and look for those opportunities.
And just a reminder, May is National Mental Health Month, and we provided the information here, the contact information for the National Alliance on Mental Illness in case you're needing to seek additional guidance or resources.
And we just wanted to leave you with this closing thought, you know. It just seemed to sum up in a very simple way what we're essentially looking for as we put together this presentation, which is that, you know what, life is tough, but so are we. And so we'll turn it back over to Laura at this point in time. Thank you all again.
Great. Thank you so much, Andrew, and thank you, Lisa, as well. We appreciate your time and for sharing your thoughts and your wisdom with us today. Now, we want you to remember, we'll provide everybody with a link to the slides. We'll also post a video recording of today's webinar on our website at axxess.com. We'd like to thank all of you for joining us today as we deliver on our mission to empower healthcare organizations and professionals with the world's best technology solutions. Have a fantastic day.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on software advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.